for tuning in today. My name is Aline Sigler. I'm with Provider Outreach and Education. And joining me in the background is my good friend Karen Curtis. She's going to be monitoring the chat. She'll be adding some links and other information there for you today. Today we're talking about the Interactive Voice Response, or IVR system. And this webinar is part of a series that we're doing on the IVR. If you've attended prior sessions, thank you. If you haven't and you want to, you can find those on our YouTube channel and on our Encore presentations page of our website. They're on our website for a limited amount of time, but we want to give you the opportunity to rewatch or watch things that maybe you didn't know about or didn't fit into your schedule. So we want to make those available to you too. Why did we choose this topic for a series of webinars? Well, that's because from the survey responses that we got from our provider community, from you, and part of those survey responses were maybe some confusion about how the IVR worked or what it could do, some frustration with being able to navigate to the things that you needed. And so just to let you know that we do take those survey responses very seriously, and we look at them daily, and we use them as ways to improve our customers' knowledge, to improve our education, and to impact your overall satisfaction, hopefully. I do want to invite you to take a look at the training center of our website. That's where we post the event materials for webinars, so a copy of the slideshows if you want to keep them for reference or you want to take notes or anything like that. We usually post them about a week in advance, and you can find those on our live events page. This is also where you can go to find out about and register for upcoming educational events. You know, maybe this one today someone forwarded to you, but on the training center of our website, that's where you can find all the sessions that are upcoming that we are offering and you can register for. The recording of this and other live webinars will be on our website as an encore presentation. So for anybody who missed the event or wants to listen to it again, wants to share it with other people, and depending on the number of events, they will normally be available for 60 to 90 days. You know, we get such a long list sometimes that we have to rotate them off, but then you can also find them on our YouTube channel. You can use the chat feature to add any questions that you have that are related to today's topic. So then at the end of our prepared remarks, we'll take as many questions as time allows today. Whether you're listening live or you're listening to the encore, we hope you take the opportunity to give us your feedback by taking the survey. Those surveys, as I mentioned, give us insight into how we're doing and also the types of education you want and need, because one question on there does ask you what topics would you like to see in future education. Now this next slide is our disclaimer message. And among other things, it lets you know that the information that we provide is as complete and accurate as it can be. But as a government program, Medicare does change sometimes, so you'll always want to look to the federal regulations. They'll take priority over anything that's in our slideshow, in our recordings, or anything like that. And we also want to remind you that CMS does prohibit the recording of our events for profit-making purposes. Karen has started the recording of this, and we do that for you so that you can refer back to it. Another thing about Medicare being a government program is that it's full of acronyms. So these next two slides contain acronyms that I used when I was making this webinar or that I know I'm specifically going to mention. So I always want to make sure that I define them for you so that you can look back and refer to them. Some of us might be newer to Medicare than others. Some of these are very familiar. Some of these you may not have run across before, and so we want you to be able to look back and be able to define those. And in that way, we don't have to spell every single thing out on every single slide because it gets to be a lot of words sometimes. So during our time together, what we're going to do is first we're going to define what the IVR is and what it can do. We're going to examine what information you need to have ready so that you can use the IVR successfully. We'll share some tips along the way on things that we've learned by using the IVR that can hopefully make it easier for you and be more efficient. And then we'll end our time together with looking at where we can find more information. In Medicare, it's not about knowing everything. It's about knowing where to find the answer that you need. So again, for those of you that are new, don't kill yourself trying to write down everything we say in a webinar or every word, because there's always places where you can go to get more information. So as our name states here, the IVR is a voice-activated system, but you do have the capability of using your touch-tone telephone keypad to interact with it as well. Right now, among other things, the IVR provides the type of information that you see here: eligibility, claim status, payments, overpayments, overlapping claims, to name a few. There are some unique features and functions for Part A providers and Part B professional claims. So this is because, first of all, the items and the services that you provide and how you bill for them is different. And so in some of our earlier sessions, we covered functions that were for both provider types. This one today is specific for Part B providers that bill Medicare on the CMS 1500 claim form or the 837P electronic equivalent. I realize most of you probably submit your claims in batches to Medicare electronically, and so we just want to differentiate that. Today we're focusing on some of those Part B options. The IVR does require users to authenticate their identity before being able to access certain claim, beneficiary, and provider-specific details. So you do have to provide certain things before you can go any further within the system. And this is sometimes might seem cumbersome, but it is to protect you, the beneficiary, and the Medicare program. This slide here outlines some of the features that are required as they relate to a provider. So we'll begin with your NPI, TTAN, and tax identification number combination. Those things have to match or mesh or sync up with the system to let the IVR know that you are who you say you are and that you are entitled to the information that you're requesting. You're only required to say or enter the last 5 digits of your tax ID, but you do have to say or enter, if you're using your keypad, the entire PTAN and NPI. You should also plan to have a remittance advice handy, because in certain situations, if you're transferred to a representative, they may ask you for something that's on that remittance advice, again, in an effort to make sure that we're not giving information to people who shouldn't have it. So then on the flip side, for beneficiary information, the elements that are required for certain inquiries. You're going to need the beneficiary's name as it appears on their Medicare card. Now, this might be different than how they're registered in your billing system or what you actually refer to or call that patient when they come into your office. If it doesn't match what Social Security has, you're either going to get wrong information or it might come back and say it can't find anything. If you're using your keypad to enter the patient's name, you're going to enter numerical equivalents for the first 6 letters of the last name and their first initial. We also need the patient's Medicare number. These days, that's known as the MBI, Medicare Beneficiary Identifier. If you've been around a while, we used to call it the HIC number, Health Insurance Claim Number. But in either case, it's the patient's Medicare number. This is also going to be what's on their red, white, and blue card, not their Medicare Advantage card, not their supplemental insurance card. It has to be their MBI. Excuse me. Then depending on what you're looking for, the IVR might also require the patient's date of birth and the date of service or a range of dates, depending on what it is that you're seeking information on. To be successful with using the IVR, some other things that we recommend are using a telephone with a handset or a headset. Sometimes speakerphones and cell phones, depending on the equipment and the sensitivity of the equipment, they may not pick up your voice as clearly as a telephone might. You know, this is going to kind of be trial and error on your part. What do you have where you work? Do you only have a cell phone? A lot of us are working from home now and strictly using our cell phones. Some of us are in offices where there's a lot of background noise. So you'll know what works best after you've used the IVR a few times. Because of that, and because of the fact that you are speaking for the most part to the IVR, if that's what you choose to do, a quiet environment is important because that background noise could cause interruptions or confusion with the system in hearing what you say. Excuse me. We also recommend that you have the IVR operating guide open for reference. You know, if you need it, if you're just getting used to using the IVR and how things work and the navigation and the little tips that we give you, that guide is really going to help you. It gives step-by-step instructions on how to enter information and how to move around within the system. I do want to have you make sure that you have the correct one open. And by that, I mean Part A versus Part B. Because like I said, the prompts will not always be the same for some of those specific options. I suggest that you bookmark it. You know, once we get out to our website, which we will go to in a little while, and we look at that IVR guide, you can bookmark that page so that you can get back to it more quickly. And I recommend that rather than saving it to your desktop or printing it, because they are making enhancements to the IVR on a regular basis. And so as the guide gets updated, you'll always have the most up-to-date one in front of you. And the same goes for the IVR conversion tool or chart that we have. You can also bookmark that page. And that way the system can help you in converting that alphabetic data into numeric format if you're going to be entering it using your telephone keypad. So when you first dial in, we have some opening messages for you. These could be things like special announcements, current issues. We usually tell you when the next customer service training closure is. And then we also give you instructions for accessing the survey at the end of your call to give us feedback about your IVR experience. And like I said, this series of webinars actually came from those survey responses. We need to know if things aren't working appropriately or you're still having trouble finding what you need. Use that survey to give us that good as well as that constructive feedback. So it's very important to do that. And those preliminary opening messages give you instructions on how to do that. So then after those opening messages, the system will give you the initial prompt. It'll say something like, in a few words, please tell me why you're calling. And so then you can respond by saying or entering what you need. For best results, if you're speaking, your responses should be short, but have enough details to route your call correctly. Some examples would be, I want to check the status of a claim, or I'm calling about a claim denial. If you just said claims, the system could take you to the claims area, but what exactly about claims are you looking for? So short, but provide enough details so the system understands what you need. Our IVR uses what we call natural language understanding. And so this allows you to just speak freely in a conversational tone as if you were talking to a person. You're not solely limited to predefined terms or touch tone options. When we look at the guide, and if you've looked at the guide before, there are recommendations within that guide for what to say or what prompts to push. But with natural language, you can speak freely to express your needs. Like I said, like you were talking to a person. So then at this point, the system is going to ask you to speak or enter your NPI, PTAN, and the last 5 digits of your tax identification number. If you'll be using your keypad, this is where the conversion tools or chart will really come in handy. Some of your PTANs might contain letters and numbers. I'm thinking of different provider types that have a combination of letters and numbers. And then after you've authenticated with those items and the system verifies that that combination that you've entered goes together, then the system will proceed with prompts to ask you or give you the information that you're asking for, excuse me. In some of our earlier sessions on the IVR, we've talked about the claim status, checks, overpayments, and question functions, and those pertain to both Part A and B providers. If you listen to them, while all the prompts and all the functions may not be exactly the same, that function does reside on both sides. Since this segment focuses on those topics that are specific for Part B providers, this slide here shows you the self-service main menu options that we're going to cover today. And we're going to talk about them in the same order as they're listed on the menu and in the guide. So we're going to go over provider summary, deductibles, and pricing. And I've also listed the corresponding keypad options. So you see those listed here where it says or press 3 or press 5, whatever. Even if the system doesn't state the touch tone options during those initial prompts, I want you to know that you can either say or key them at any time. And it's really whichever you prefer. And then I also want to explain just a little bit more about how this presentation is set up. So first we're going to go over each of these things, like I said, in this order that they're presented here. We're going to take a look at what data or information is required for each of these functions. And then we'll review the response that the system gives you, or the details. And if there's additional requests that you can make after getting those details, then we'll cover those as well. So let's get started. All right. Sorry, got a dry throat and I'm afraid I'm going to cough. We're going to start with provider summary. So the purpose of provider summary is to give billers a current snapshot excuse me, of the number of claims pending in the claims processing system and their corresponding dollar amount. So you've already authenticated to get this far in the system, so no other data is required. So you've put in your NPI, you've put in your PTAN, the last 5 digits of your tax ID. So this slide shows the responses that the system will give you. It's going to give you the number of claims pending, the dollar amount of those pending claims, the total number and dollar amount of approved to pay claims, and the number and dollar amount of approved to pay claims that are less than 14 days old. If you haven't used this function before, know that the data changes daily as claims are billed and processed. So this isn't to be used for any definite bookkeeping or accounting purposes. It's for informational only. The provider summary is just that. It's for informational only, and it's not meant to be a tool for tracking specific claims or anything like that as they go through and adjudicate through the system. It's just a snapshot, really, of where your claims are at, what's going on with them. So you should see them move through the system on a regular basis. In addition to these items, the IVR is going to also tell you about the last check issued for the PTAN that you entered. So for the provider number that you entered, this includes the check date, check amount, and the check number. And just to clarify, when we say check, when the system says check, it could also be payments made by electronic funds transfer. Occasionally, we do send paper checks, but the majority of our providers are paid by EFT, electronic funds transfer. So don't let that word check throw you, because you might think, well, we don't get checks, we get paid electronically. We realize that it's just kind of a in this case a random generic term that we're using for payment. Okay. So then after you receive your provider summary information, then there's other requests that you can make. You can say, repeat that to hear the information again. You can say details for additional information. We'll talk about those details in just a second. You have the option of changing the provider details. So if you work for more than one provider, even under the same NPI, you can check information for more than one. And if you want to start over, you can say main menu. All right, let's go to those details there where there's more information available. So I mentioned that if you say details after receiving the initial response, you're going to hear the items that you see listed here. You're going to see the number and dollar amount of month-to-date and year-to-date claims. We realize that this isn't going to apply to everyone. Not everybody's interested in that information, but it's good to know it's there if you are interested in it and you can use that information. Okay, so let's move on to the next function that we're going to talk about. Okay, I got scared there. My system didn't move. And that is the deductible status. So for this option, you're going to need to enter or say the patient's Medicare number, the MBI, patient's first and last name. Remember, if you're entering it on your telephone keypad, you only need the first 6 digits of the patient's last name. And then you're also going to need their date of birth. And then once you do that, the IVR is going to respond with the amount that's applied to the current year's deductible. So as an example, the Part B deductible for 2024 is $240. So whatever the system says is applied can then be subtracted so you know how much is left or needs to be met for the year. That depends on how often the patient is seen by a physician or how often they have a service that's billed to Medicare. Some patients that deductible gets applied in the first month or a couple weeks of the year. But some patients, it might be that this time of year, you know, November, they've still got some deductible remaining. So it just depends. But this is a quick way that you can check to see what their status is and where they're at with that deductible to know if any of it, is going to be applied to your claim. And then once you get the deductible information, you can say repeat that, or you can say main menu again if you want to start over. If the IVR prompts you by saying, tell me another patient's Medicare number, you can say or enter another patient's MBI and check the deductible for them as well. It depends on what you're looking for, what your role is at your office, and what you need. So the next function of the IVR that we're going to examine in this session is called pricing. Users will need the elements that you see listed here. So you're going to need the procedure code, the modifier, if you've used one. If you didn't, you can say no modifier. It is important to note, though, that the IVR will only recognize modifiers that affect pricing. There are a few of them listed and in the IVR operating guide. We'll look at that in just a minute. You're also going to need to say or enter the place of service code, the zip code of the location where the services are rendered, and the date of service. And then the system responds with the Medicare allowed amount that matches the criteria that you entered. Once you get that pricing information, you can say, repeat that to hear it again, change the procedure code to get pricing for a different code. You can change the NPI or P10, and finally, if you want to start over, you can say main menu. I hope that, taking a look at some of these functions that the IVR has gave you some insight into what more this self-service option can do to assist you, your group, or your office. I do want to share a couple additional tips with you. First, you don't have to wait for the entire prompt to play. You can go ahead and key or speak your selection. And as you get more used to using the IVR, the more you do it, you'll know what the next step is. So you don't have to, listen to Charlie Brown's teacher. How does it sound? Wah, wah, wah. You can just go ahead and key or enter or speak your request at any time. If the IVR has trouble understanding what you're saying, go ahead and switch over to using your keypad instead. And that would be in cases where, maybe you've got a head cold, some sinus stuff going on, you just don't sound like yourself. A construction crew is using a jackhammer outside your window. the phone in the next cubicle is ringing, there's a patient at the front desk that it's picking up their voice instead of your voice, whatever the case may be, if the IVR has trouble recognizing what you're saying, rather than getting frustrated, just switch over to using your telephone keypad. That would be your best bet. And then use the guide. The guide can really become helpful for you until you become accustomed to using the IVR and the navigation. If the IVR says you can say additional information, that usually means that there is more data associated and with and available for your request. And then I know that I mentioned this before, but you will not hear the touch tone options during those initial prompts, but know that they are available for you to key at any time. So what I want to do now, I'm getting nervous because it's taken a little time when I press to go to the next slide. So now what I want to do is, as I promised, show you how you can find more information. Where can you find the guide? Where can you find the conversion tools? So what I want to do is go out to the WPS website. I do have this screenshot hyperlinked, but for some reason, if I couldn't get to the website, or you were looking at the slide deck and discussing it with someone else, you just wanted to refresh your memory, we added the screenshot here with arrows to kind of point to where we're going to go to help you once you get out there. I'm going to go out to the website, and I've already been out there today. So right now I'm in J5 Mac Part B. We're talking about Part B topics. So you want to make sure if you work with both that you're in the right one, because the guides and the options are different. But first, when you come to our website, I just want to show you over here on the right in the quick links, we have a whole list of things that are popular items that get a lot of quote unquote hits on our website. And so we try to put things here that get used most often. So you see that the IVR conversion tool is listed right here under the quick links. It might not always be there. So I think it's important for us to know how to find those things without the quick links also. So we're going to go up to the topic center, and in the drop down, we're going to go to self-service. The IVR is a self-service tool. And then you'll notice right here at the top is an article about natural language in the IVR and the IVR operating guide. We're looking at the Part B one today. It's also listed down here. We can expand this item and see both of those things listed here. So multiple ways to get to the same information. So I'm going to open the Part B IVR operating guide. You can see that it is divided into chapters or topics here. And I first want to go to the entering data section, because that actually is the conversion tools. So we have the beneficiary name converter, and then we also have a separate one for PTAN and MBI. Our MBIs are a random combination of numbers and letters. So by entering it here, it will tell you exactly what to key in if you're using your telephone keypad. So for an example, my last name is exactly 6 digits. Remember, we only need the 6 digits, but if it was longer than that, it would only take the 6. And I put in my first initial. You can see that right here, this is what you would enter into your telephone keypad if you were looking for something related to me if I was your patient. So I just wanted to show you how that works. Now, if I scroll down just a little bit more, this is the chart that I spoke about. So if you're a person who likes one-page cheat sheets or something like that, this might be something you could print and you could have it at your workstation for those times where, you know, maybe you only work with one P10, you only work with one NPI, and so you could have that all readily available. And again, you're going to become more used to it the more that you use the IVR. So I just wanted you to know how to find those things. I'm going to go back because I mentioned when we were talking about pricing, let me scroll down here, and in the section about pricing, we were talking about certain modifiers. And we were talking about how the system only recognizes certain modifiers that affect payment. So you can see, as I scroll down, the list of the modifiers right here. Let me just highlight this for you. So if you enter or say other modifiers, that's okay. But if it doesn't affect the pricing, the IVR is just going to kind of ignore it. All right, I want to go back to our PowerPoint now. So I hope finding those items will be helpful for you. Now this slide, if you've downloaded a copy of the slide deck, you have this slide and it has hyperlinks to each of these tools. The guide we just looked at, the conversion tool, which is part of the guide. Remember, it was that entering data section, that article about natural language, what is it, how to use it, some suggestions for you, and then also a separate resource related to the MAC Beneficiary and Provider Communications Manual. This manual talks about the requirements of MACs to have provider self-service tools and the requirements for providers to use those self-service tools rather than calling customer service if your question is something that can be answered by a provider self-service tool. So again, we always want to give you places to go to get more information about what we're talking about, where you can see it in black and white, and get the actual regulations, because CMS, MACs, providers, we all have to follow the guidance that's in those manuals from CMS. So the next thing that I want to talk about is related to the IVR. And this is a change request that was fairly recently released by CMS. And this change request, 13754, says that even though right now users can still obtain beneficiary eligibility in the IVR, CMS is directing all MACs to disable that information, and the date that the CR states is by March 31st of 2025. WPS has made the decision to remove this option by January 1st of 2025, and so we want to give you the heads up. Now, why is this? CMS is committed to protecting beneficiaries from Medicare fraud. They have to protect the Medicare Trust Fund, and so this is part of that ongoing effort. If you want to take a look at this change request, it goes on to state that this is a pilot. It does involve most MACs, and then CMS is going to continually monitor the impact that this change makes, and then they'll evaluate whether the eligibility function will be reinstated or it will become permanently discontinued. This slide also lists the other self-service options that you have to check eligibility. And so the Secure Net Access Portal, or SNAP, which is the new name of the secure side of our website, so the provider portal that you've been using. You can get eligibility in there. Part A providers can use direct data entry. I know that this is a Part B webinar, but still putting it out there because some of you may work with Part A and Part B, but eligibility can be obtained in DDE. And then finally, we have the HIPAA Eligibility Transaction System, or HETS. Providers can also get beneficiary information from there through your vendor. To get any updates on this information, we invite you to watch our weekly e-news listserv. Make sure you signed up for those. Also on our website, if there's any updates, if that date were to change or, you know, down the line, like I said, CMS was going to evaluate the impact of this and then decide whether it was going to become permanent or not. We just want to make sure that everybody knows. So from now until December 31st, you can still use the IVR for eligibility, but come January 1, there will be some changes. And so we don't want anyone to be blindsided by that. Next, we have another announcement, and this is pretty exciting. This slide is not in your handout because it is such a new announcement, but we want to invite you to join the Centers for Medicare and Medicaid Services in our Chicago regional office, the local engagement and administration area for a special event. The CMS Chicago office is going to host a Medicare open enrollment event on November 15th. It will begin at 1:30 p.m. Central Time. It is an hour. And this is kind of a hybrid event, so you can attend in person at the CMS office or virtually via Zoom. This event is designed to keep you up to date on information important to you and your patients. As you know, each year Medicare offers a Medicare open enrollment period from October 15th to December 7th. And during this time, your patients are encouraged to review their current Medicare health plan coverage, and sometimes they may ask you for assistance. They may ask for your input. And while we can't influence their decision, we can help them find ways to get more information. So this event is going to help you understand the Medicare open enrollment process and then what resources are available to assist your patients in their health plan coverage decisions. CMS recommends that facility or group or private health care providers, nurses, registration personnel, discharge planners, social workers, and any other support staff that assists you with your patients attend this event to get more information. Registration is required. We will put the registration link in the chat, or you can go to our live events page. We do have a link to the registration there. And during that registration process, it asks if you will be attending in person at the Chicago office or virtually. If you are attending in person, please register by November 11th. And then in order to receive the webinar information, please register at least 24 hours before the event. Again, it's on November 15th, starting at 1:30 p.m. Central Time. It does last for an hour, and it's new news. So this session is for CMS Chicago regional partners. So those are for providers that we have in Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. So if you're listening to this and you're located in any of the other states, if you want assistance in connecting with your local CMS office, we also are going to add some information in the chat so that you can contact them to see if they have a similar event that you can attend. I know that was a lot of information in a short amount of time. I'm going to check in with Karen now. I want to see if you have any questions for me. Karen?
Thank you so much for all that great information, Lean. At this time, we have not had any questions come through in the chat.
All right, thank you for checking, and thank you for your help behind the scenes. When I'm sharing my PowerPoint, I can't see the chat, so I really appreciate Karen's help today, so thank you. We're just going to keep going. In about 15 minutes, you're going to receive an email that's going to thank you for attending. And among other things, this email contains your certificate of achievement. It's going to look similar to what you see on the right half of your screen here. This is an example of what that email might look like. So again, it's going to have your name in the top. It'll have today's date, the title of this training. It'll have your contact hours. So if you are interested in continuing education units, you can download, print, whatever, this email and send it to your accrediting body for consideration for CEUs. It also contains a link to our survey. You're going to have a lot of different ways to give us your feedback. Whichever way you prefer, please give us your feedback. So we just wanted to give you a look at this email and know that if the CEUs are something that are important to you, you don't disregard that email. You don't think it's junk, you don't think it's spam, and delete it because that is your certificate and it does have your contact hours. If you don't see it, like I said, in the next 15 minutes or so, check your junk or spam folder. It'll come from messenger@webex. You'll see that that email, and if you don't see it, make sure that you add them to your safe sender list. That way you can get reminders and things like that for our webinars. If you do think of a question later, you do have 1 week from today to submit it to us. Send them to our same education mailbox that you see here. Put something about the IVR or IVR Essentials in the subject line, and those emails will come directly to me. I'll put them all together, provide an answer, and I'll send them out to everybody that attended the live event. If you have any claim-specific questions, however, I don't have access to the system, and so those will have to go to customer service. Please take a few minutes to give us your feedback with a survey about this course. You know, tell us what you think, how we're doing. How likely are you to attend other courses? Would you recommend our education to other people? We want to know what you liked, what we could do better. We want to hear your suggestions for future education. I mentioned that you have a few options, depending on your preference. You can use the link that's in the chat, or when you exit the webinar, you'll be asked to go to an external site. And the external site is the CMS Qualtrics page for the survey. And that message is going to look something like this here, where it says external site. It'll have the triangle. It'll have the blue continue button. And just so you know that that is specifically for the survey. It's not an ad. We're not trying to sell you anything or do anything malicious. It's just for the survey. And we can't change the verbiage of this message, and so we just want to make sure that you're aware of what that is and why you're seeing it. If you're listening to the encore of this presentation, a box will appear that links you to the survey, and it's going to look like this box here at the top. That's going to be a link to the survey. Or if you're looking at the encore, if you scroll down into the description of the video on YouTube, there'll also be a link there. Any of those ways will take you to the survey. You only have to do it once, but please do it. Those surveys give us insight into how we're doing and lets us know the types of education that you want and you need. So on behalf of myself, of Karen, and all of us in Provider Outreach and Education, I want to thank you for your attention today. Thank you for taking the time to join us today. We hope to have you on future education We look forward to your survey feedback, and you may now disconnect. Thanks, everybody. Have a great day.